So yes, I'm Heather Pulaski. I'm with the Division of Obstetrics and Gynecology from the university, and I'm in the Division of Gynecologic Oncology. A lot of people ask kind of what does gynecological cancers mean? And I think honestly probably one of the best and easiest ways to explain it is what my boss tells people, is that we do all the cancers that are covered by the panty area. So that means we do vulvar cancer, vaginal cancer, cervical, uterine, and ovarian cancer. This is an estimated from the SEER database from 2011. But they estimated that in this last year, more than 85,000 women would have been diagnosed with some sort of gynecological cancer. Actually, in the United States, about 1 out of every 3 women will develop cancer from some site. When you look here at gynecological cancers, you can see that your risk for uterine cancer is about 1 in 40 on estimate, ovary cancer about 1 in 70, and cervical cancer about 1 in 135. We don't really know what causes ovarian cancer. The most popular hypothesis is that it's some sort of ovulation trauma. There's an increased risk in any woman that has a higher number of ovulations during her lifetime, like having no prior pregnancies, increases that risk about 2 to 3-fold. So what can we do to protect ourselves from ovarian cancer? Well, one of the things is pregnancy. Pregnancy obviously decreases ovulation for 9 months, and we know that having even just one pregnancy offers about a 40% decreased risk of developing ovarian cancer over the rest of your lifetime. Birth control pills basically work the same thing by suppressing ovulation. Breastfeeding causes about a 20% risk reduction. So for ovarian cancer symptoms, about 95% of women do report symptoms, things like fatigue, abdominal bloating. So for treatment, it basically usually involves some sort of surgery to remove the ovary and get a histological diagnosis. But ovarian cancer cannot be treated by surgery alone, and it always involves multimodality treatment with chemotherapy. Now we're going to talk a little bit about uterine cancer. Uterine cancer usually comes about because of unopposed estrogen stimulation of the uterine lining. So protective factors, birth control pills actually decrease the risk by decreasing the amount of estrogen. Pregnancy also offers that protective effect, and also being an active, healthy weight decreases the risk. Symptoms, about 90% of patients have some sort of abnormal discharge, and about 80% have some sort of postmenopausal bleeding that comes from the overgrowth of the uterine lining. Just one last little bit about cervical cancer. Cervical cancer risk factor alone is basically HPV infection. But here in the United States, if you see your gynecologist and you get your pap smear, we can usually catch cervical cancer. For protection, basically the best protection we have now is the HPV vaccine. It's recommended for all girls basically ages 9 to 26. Barrier contraception is also important in preventing HPV infection, and also eating a diet rich in folate we found is actually somewhat protective for the virus. Biggest advancement we've had probably in the last 5 years is a surgical robot. We use it for probably almost all of our endometrial and cervical cancer cases. And really what that's done is it's taken us from making this huge incision that we used to make to making these 5 small incisions instead.